Hi guys, Devin here from American Aquarium Products. I wanted to give you guys some higher level professional medication treatment information with some medication examples, common medications that are often used, plus some professional examples to help give some context of when we're supposed to be using these recommendations. Are you supposed to do a water change when you're dosing medications? And the answer is yes, but there is some explanation behind that and how to do it properly. So water changes can be done prior to every treatment or at least every 48 hours during the process to improve the infectancy and lower the possible toxicity of the treatment. So we want to do it. And if we're dosing through a food soak, we want to be doing it every 48 hours. 20% or a little more water change can cut back on the organics in the water column that often absorb many medications and lowering their effectiveness. However, we don't want to do a water change in the middle of a treatment as it will dilute the medication and possibly render it ineffective. So there is some strategy on how to do this. An example is if there's dosing that's going to be done on day 1 and day 3, the water change should not be done on day 2, but rather on the 3rd day immediately right before the dosing of the medication. As well, some medications break down between 24 and 48 hours, leaving behind a moderately mild toxic chemical, which a water change prior to the next treatment, which helps lower or completely remove that toxicity. We've also talked about placing carbon or similar products, such as Secam Purigen, into the filter for an hour or 2 prior to the treatment, and this can help remove ineffective or exhausted medications. The use of a water change or short-term carbon, Purigen, etc. can also allow for a longer use of many medications. This is especially important when using a medication such as triple sulfa to buffer malachi green. Another example from our professional experience is tetracycline and malachi green, which can be both more effective and less toxic if a water change or the carbon filtration is performed immediately prior to the follow-up treatment. Here's another little tip based on professional experience. The use of a professional medicated slime coat water conditioner such as AAP Res-Q is strongly suggested immediately following every water change. This product is superior to even the well-known Prime or Stress Coat. So not only will AAP Res-Q remove chlorine from the water, it improves the effectiveness of the medication regimen. Also be aware that chemical dyes such as malachi green can be at least partly removed by most water conditioners such as Prime, Start Right, AAP Shield X, or Res-Q. We do suggest using these water conditioners after a water change and then waiting 15 to 30 minutes prior to adding the chemical dye. We have some more information about aquarium water conditioners you guys can see in the resource below. It goes over the use and the information of each and how we suggest them based on professional use. We do want to say, however, so while we're doing our water change, we want to make sure we're not doing too large of a water change, as this dilutes medications, in particular something like the AAP medicated Wonder Shell where it's a slow release medication dose. Here's a last example I'll leave with you guys that we observed over some years of making professional recommendations. We've noticed that we'll make the professional recommendations and then oftentimes people will do, say, like a 50 to 100% water change during the course of the treatment, but not really monitoring the parameters, as in they don't know that they need that, and many times they don't need that. So it just renders the medication not useful because it's not being maintained at that therapeutic level. So there's no effectiveness. The bottom line for all this video is just make sure to stick to the 20% water changes before each treatment. And if you're using a slow release medication, sometimes water changes are not even necessary. Also know we have a whole list of medications and water conditioners that we recommend keeping on hand. I'll put that in a link in the article description below. Help you guys out just being prepared, having what most people need on hand at all times. I hope that helps you guys out in some way, knowing that you're supposed to be doing water changes while doing a medication treatment, but not too much. If you guys have any questions about this topic, feel free to ask, and also take a look at the links in the description below for a lot more information. I'll talk to you guys next time. Thank you so much for your support. Bye.